Okay, hello and welcome everyone to today's health and safety webinar. My name is Stuart Clough. I'm a Senior Communications Manager here at Moorepay, and it is my great pleasure to introduce today's topic to you, health and safety, understanding your business risk. But before we get into the main topic, let me just run through a few housekeeping matters and I'll introduce both Moorepay and your host today to anyone unfamiliar with either. I know we have a few Moorepay familiars and a few people who are probably less familiar with the business. Now, before we get into the main body of the webinar, a few housekeeping matters I just want to quickly run through with you. So, first of all, questions. I'm sure there's plenty of questions will come up as we run through the webinar. You should see on the dashboard of the webinar software, you'll see a questions tab. So if you can post your questions in there, it helps us as they come up. It's really helpful for picking those up and being able to be prepared for when we get to the Q&A session, which we'll have after the close of the main body of the webinar. So that's the questions tab on the dashboard. You should find that there. You'll also see a chat box. So the chat box is really there for if you've got any other issues, if you're struggling with the slides aren't working or any other issues you're coming up and you need a bit of help with something, just drop it in there and I'll do my best to help you as we go through the webinar. But as I say, any questions, put them in the questions box, and then when we get through to the Q&A at the end, we'll pick those up, and obviously you'll be able to ask more questions then as well. Okay, so without further ado, let me just quickly introduce Moorepay itself. So Moorepay are trusted experts in payroll, HR, and health and safety solutions. We've been around since 1966. We like to think of ourselves as born winners. 10,000 customers across the UK. We do 150 HR and health and safety engagements every day. For the payroll side of our business, we process 500,000 pay slips every month. As part of the wider business, we actually we're part of a group of businesses called Zealous, previously known as NGA UK. As part of that group, we actually pay 1 in 6 of the UK workforce. So we've got a big breadth of experience across every conceivable industry and size of business as well. You know, from one-man bands, startups, growing businesses, you know, up to I think some of our biggest customers will have an excess of 10,000, 15,000 employees. So there's a real breadth of companies we work with, and that's with all our different service offerings. As you can see on what we call the Moorepay service wheel there, I'm not dwelling on it, but you can see we do software. Our Moorepay HR software offers HR analytics, people analytics, learning management solutions in there. We have a health and safety built into our HR hub. There's all manner of different things in there, and if you're interested, you can go on our website and you'll find much more about that. And obviously, as a health and safety provider, we're industry accredited up to our eyeballs. I won't run through all of those, but CHAS, Chartered Institute of Environmental Health, NEBOSH, IOSH, CIPD, lots of acronyms, but behind that is a lot of work and a lot of studied professionals who know their business. So that's Moorepay. So let me introduce you and obviously find out more about us on the website, or you can call the number there and I'll flag these up again later. That's Moorepay, but let me introduce today's host to you, the one, the only Mr. Philip Barker, our Head of Health and Safety Services. Now, little birdie told me this week that this is actually the 11 years this week that Phil joined Moorepay as a sprightly young soul, as he still is, both spiritually and physically. He manages our team of health and safety consultants. He's a chartered member of the Institute of Occupational Safety and Health. He's a registered consultant. He's an associate member of the Institute of Fire Safety Managers. He's incredibly well versed and professionally accredited in all manner of health and safety requirements. Before joining Moorepay, Phil ran a team of 6 responsible for health and safety at one of the big 5 grocers. I'm not I'm not allowed to say which one, but one of the big five grocers. As I say, his health and safety runs through his veins. I think he's a second generation health and safety professional. And he's our point of contact with our various enforcement agencies across the health and safety world. So Phil is incredibly well knowledgeable on all matters of health and safety, and I encourage you to look him up on LinkedIn and follow him there, because he's always posting relevant, interesting insights into that. And if you drop in an email, always happy to respond. But enough fluff. I know that Phil won't want me to go on too long, so without further ado, allow me to hand over to Phil, who will take you through the main body of today's webinar.
Okay, hi guys. Yes, some familiar names on the list of attendees, so some of you will know me and recognise this amazing Yorkshire accent, and some of you this will be a completely new to. But we're just going to go through the agenda. What we're going to really cover today is the business risk ranking, and if you can see in that little screenshot there, we can see some really red, amber and greens, and we'll talk about that in a little bit more detail. But before we get on to the risk ranking map and how we created that data and what it tells us, we're going to quickly revisit the sentencing guidelines, because I believe the sentencing guidelines have an impact into why some of these areas are red, and also some really underlying reasons as to why business owners and business managers really need to start to take health and safety probably more seriously than they may have done in the past. Not saying there's businesses on this call that don't take health and safety seriously, but all too often we see health and safety being a secondary concern to running the day job. And we'll talk about later how realistically it should be part and parcel of looking at that. Excuse me. We'll look at a couple of cases that the HSE reported in the news on their press releases this week, and just see how the fines and the impact on individuals are reflected in current context. Then we'll have a look at the locations of the business map, and we're actually going to pull up my hometown, Doncaster, just to see how Doncaster fares. And if there is anybody else on the call from Doncaster, I can tell you now it actually got worse in the last 6 months than it was on the previous 6 months. So yeah, we'll look at that in more detail later. But yeah, so just moving on, and we'll start to look at the sentencing guidelines. So a while back, the sentencing guidelines have been in place now roughly for 3 years. Here we're talking really about sentencing guidelines that apply to health and safety, food safety and corporate manslaughter legislation. About within the last 6 to 12 months, there was another sentencing guideline that refers to gross negligence manslaughter, which has further impacted the potential prosecutions for a business owner following a fatality at work. But not going into too much detail with those because they're not specifically related at health and safety legislation. They're more of a wider guidelines, but the guidelines that we're talking about at the moment were specific to health and safety, food safety and corporate manslaughter. The guidelines applied only in England, Wales, Northern Ireland. They don't apply in Scotland, although we have seen Scottish judgments reference them as a guidance tool. So whilst not been binding to Scottish courts, the Scottish courts are using these as a benchmark when setting sentencing. About when the sentencing guidelines first came out, we did 2 years worth of data tracking, and we found that in 1 quarter we saw 17 individuals prosecuted. So that's not companies, that's people within the business, so senior directors, senior managers, the odd employee. But say we saw 17 in 1 quarter. So multiply that by 4 and you get an average for a year. Now, prior to the sentencing guidelines coming out in 2016, there was an average of 5 a year of personal prosecutions. So what we've seen since the 2016 sentencing guidelines came into being is an increased tendency for the HSE to prosecute individuals alongside or instead of the business that they run or work for. And so we'll look at that in a couple of examples in a bit. And the HSE have quite often on their press releases when it does involve an individual prosecution is the last bullet point there. This comes from their press releases. It's a standard text, I think. The HSE will not shrink from taking legal action against any individual. And as I've said in the past, we've seen employees prosecuted. as well as managing directors and directors. So depending on the instance, you can have a chain of events that result in multiple prosecutions. There was a case in Manchester probably 18 months, 2 years ago now, where a scaffolder got prosecuted, his employer got prosecuted, the client who had employed the contractor who had employed the scaffolder got prosecuted, and the hotel that had employed the building contractor got prosecuted. So there can be a significant chain of events from a single breach of legislation. But if you look at the graphic on the right-hand side there, this relates for Q1, and I think it was Q1 2017, the data that we just extracted here, but I might be wrong. Yeah, and we can see there that you've got a range of people. So you've got contractors, inspectors, builders, owners, tree surgeons, all different type of definitions and people being prosecuted. There is not just one business sector or job description that is at greater risk. Even down to health and safety consultants, there is unfortunately a tendency for health and safety consultants to also be prosecuted, which obviously we try to make sure we don't fall into that trap. So the sentencing guidelines in a little bit more detail. I could spend a full day talking about sentencing guidelines, so I'm just going to try and show you why they've made such a big impact. And this is just one table within the guidelines. And when the judge has decided that somebody's guilty of an offence, they look at these tables and work out what the starting points for the sentencing should be. In this case, we're looking at a table for a small business. So that's a business that's got a turnover of between 2 and 10 million. There are various tables for the different size business turnovers. The judge then will, once he's picked the right table to look at for your business turnover, they will then look at the potential harm that could have happened. So gone are the days of somebody actually needing to be hurt for a large fine to kick in. We have seen businesses, large security companies, cash handling businesses who've been prosecuted hundreds of thousands of pounds for breaches of Legionella legislation, and nobody had a cough, had a cold. It was just the fact that they weren't managing it properly, and the potential was that somebody could die from Legionnaire's disease. They ended up with a massive hundreds of £1,000s fine. But as we can see here, if in a small business, the court thinks that the business was very highly culpable, in other words, we're not managing health and safety to any degree, then the starting point for the fines can be up in the £300,000, £450,000 bracket, even where they're thinking that the business was doing as much as it could. So we're in the low culpability end. We could be talking £45,000, £50,000 for a fine. There's a lot of other factors that the courts bring into there. And like I said, I could spend all day talking around the whole process, but just to give you an idea of how the courts come up with these figures. So it's based on the level of the level of the potential outcome. So was it going to be a broken bone? Was it just going to be a paper cut? Was it going to be somebody dying? And that's where the starting point looks at. And that's where the harm categories come in on the table you're looking at, and how culpable was the defendant in this case, because we're looking at a business, how culpable was the business in that offence happening. The next one I'm going to look at is just to emphasise the importance or the risk to individuals. So these are the potential where people can get actually jail sentences, prison sentences, and we start to look at again for very high culpable. The harm category can only be a harm category 3, which isn't that serious, and we could be talking at a 26-week jail sentence. Even if we're looking at medium culpability and the outcome of the risk is high, again, we could be looking at 26-week prison sentence as a starting point. And just to show how that actually does happen in practice, we're going to just look at a couple of examples. But I'll just to summarise the sentencing guidelines, just to make sure I covered all the points on the previous slide. We have a standard process now for determining fines and sentencing. So it's not down to the individual courts just going and sitting in a room and coming up and rolling a dice and coming out with a figure. They have a standard process, which means that we're seeing reasonably standardised fines depending on which area of the business, which area of the country, sorry, the court is the case has been heard. It's based on a likely outcome, so no longer the actual harm. It's what could have happened. It accounts for levels of culpability. We've seen increased fines, and we're seeing an increase 4- or 5-fold of directors and business owners being successfully prosecuted. So just one that we picked up yesterday, just had a quick look on the HC website, and this is one of 2 that we could have picked up on. There was 2 very, very similar cases, both involving construction type activities, both involving falls from height, and both where the directors received 200 hours of unpaid community service. They call it unpaid work now, but in general terms, it's community service. So it's 200 hours of wearing a high-vis vest that says probation service on the back of it and picking litter up at the side of the motorway. So we are really seeing individual company directors start to get fined and custodial type sentences for health and safety offences, and that's on top of, in this case, the business being fined £50,000. So it was a double hit, really. The business owner took a hit through his profits on his business and also got 200 hours of community service. On this one is a hand down vibration issue. Hand down vibration tends to be associated with road workers, mining engineers, and the old traditional heavy industries. But here we have a housing association who had employees going out on site, just putting up satellite aerials and these kind of things, just normal using hand tools. Weren't managing hand down vibration properly, weren't doing occupational health monitoring, and the business ended up with a £20,000 fine. Again, here there was only one employee who had some minor side effects from hand down vibration, but the potential could be that multiple employees could lose all the feeling in the fingers. So again, we're seeing that the higher level of fines because of that potential outcome. And it's just simple hand down vibration. It's just simple to have checks in place to make sure that people are not using tools too long. It's not rocket science. It's not difficult. And it's just one thing that employers that have got hand down, that are using tools that vibrate, really need to get a grip of. Sorry, pardon the pun. A loose grip of, so we don't get too much vibration from having a hard grip. Yeah, so just moving on. So we're quickly going to have a look at the effects of our risk ranking map now. And just excuse me while I just take a drink. This is a piece of work that we did initially about a year ago. We initially launched this, maybe a bit less. We took the HSE's data that they publish every 12 months, and we thought, how can we make that actually mean something rather than just be 20, 30 Excel spreadsheet charts? So we gave it to some clever people who created this map. We look at a variety of the indicators on the HSE data. So how likely you are within a region to have an accident or an illness, how likely you are to be prosecuted. And again, these clever mathematicians who are a lot better at it than me came up with a ranking ratio, and we scored the businesses or the regions. And as you can see, we've got some bright red and some bright green colours. Altogether, there was 31 indicators in there that created that data. We were looking to try and do it by industry within each region, but that's not possible because the HSE data doesn't drill down into that detail across all of the, because the way health and safety is enforced between health and safety executive and local authority environmental health, the data for industries is only part complete from the HSE. We don't have the equivalent data from the environmental health officers, so the data would have been skewed, so we decided not to include those. But we mapped the data against all 380 local authorities. So it's done by region, so you've got, for argument's sake, Yorkshire and Humber, and then within Yorkshire and Humber you'll have Hull, Doncaster, Leeds, Barnsley, Sheffield, etc., etc. So we'll just go on and have a look at what that means. Like I said earlier, we're looking at Doncaster, which is my hometown, because I was just being curious as to see what happened, and we had some interesting results. Now, when we first did this well, October time on the previous results, Doncaster was actually in orange, and now we've looked at the second screenshot you've got across there. Doncaster is in bright red. So for some reason, which I need to sort of get a little bit more look at the data, so that I can talk to local businesses about this. Doncaster has actually got a little bit worse in its ranking, and the risk to businesses in the Doncaster area is slightly worse in the previous 12 months. Sorry, in the last 12 months, it was in the previous 12 months. You'll get a similar report to this for every single local authority. You just go onto the website, enter your postcode or your town, and it creates an output similar to this for your own benefit. But what if we were to look at this in detail? What we can see is that Doncaster is a high risk of having an accident, it's a high risk of a prosecution, and also a high risk for employee well-being. And if you could have the report in front of you, what you would see on the well-being piece is that every employee in the Doncaster area, on average, will have 5 days off work sick as a result of something that's happened at work. So that'll be stress, work-related asthma, manual handling, some kind of illness that has happened at work or been made worse by being at work will result in every employee within the Doncaster Council area having another 5 days off work on top of the holidays. Now, what we know from absenteeism, from other surveys and studies that we've done, is that is only the tip of the iceberg. What you will see is you see a lot of presenteeism, especially when we're talking stress. People tend to come to work and hide the symptoms. So if you're thinking that we've got everybody's taking 5 days off work, there's probably 20 to 25 days of unproductive work there as well. So looking after health and safety, looking after the health of your employees, it's not just because the law says we have to do it. It makes good business sense. If you can reduce absenteeism from work-related ill health, you're increasing your productivity of your people at work. Again, we could be talking, what we know about from the figures is within the Doncaster area alone, we could have people at work 5 days a year more than they would be currently. And for those that are turning up to work even when they shouldn't be, we could have another 20 days of productive work out of each employee a year. Multiply that up over the number of employees you've got in your business, and we're suddenly targeting improving productivity by massive, massive amounts. So health and safety is not about complying with legislation. It's not about doing risk assessments for the sake of doing risk assessments. It's about making sure your staff are looked after, that they come to work, that they're fit to do their job, and that you can have a productive business. And I've just gone off on a preaching session there, but I apologise. So feel free to go on. The links, the link will be emailed out to you, so you can go on and have a look at your own area and how that applies. But if I was advising a business in Doncaster on how they could prevent that risk, that those red areas, and resulting in the individual directors ending up with high fines or even worse, jail sentences, this is the advice I'd be giving to a Doncaster business. So what they need to be thinking about is how they can mitigate their business risk. Murphy's Law, Sod's Law, whatever you want to call it, says that something will go wrong at some point in a business. You trade 365 days a year, some businesses 24 hours a day. Something at some point is going to go wrong. We just need to make sure that's minimized, and that is a very rare occasion when something does go wrong. And if it does go wrong, have we got policies and procedures in place to make sure that we've done everything possible as an employer to prevent that accident from happening? Are we effectively managing these through third-party audits? Do we have other people come in and check that our staff are doing what the policies and procedures say they're supposed to do? Do we know whether our risk assessments are suitable and sufficient? When did we last review the risk assessments? Are they just pieces of paper on a shelf? That shows how I'm old-fashioned. Or more modern, are they just a Word document on a laptop that nobody ever sees? And have we trained our staff? Do our staff know what they should be doing? Are they wearing the right PPE? Are they managing health and safety properly? Are they doing what they should do because they want to do it that way, not because somebody's been telling them to do it that way. There's a whole culture of making sure that we do health and safety properly. It starts at the top, it works its way down, but it's not just about paperwork, it's about people wanting to do things right. And we just need to make sure that we've got the right attitudes in the business. Otherwise, all the bits of paper are meaningless. So, whistle-stop tour there, and I said I could have gone on for days just on sentencing guidelines, and you'd have all fallen asleep. But has anybody got any questions at this point in time?
Okay, everyone. So just as a reminder, and sorry, also thanks, Phil, for a whistle-stop tour, but some really crucial points in there. So in terms of questions, as I say, if you can post them in the question box, you'll find, then we'll be able to run through those and put them to Phil, and then we can get any questions you want answered. And we're always keen to say that you can be you can ask some general questions. You can ask specific ones about circumstances you're facing. We'll always make sure obviously that's anonymized, but we'll keep that. We'll make sure anyway that you can get the most out of this session that you can. Okay, so just to clarify, for anyone who was, I know we started bang on top of the hour, and to anyone who joined afterwards, then we will be sending both a recording of this webinar out afterward, and we'll also send a copy of the slides as well, and the link, as Phil said, to the Risk Rank website. Okay, so so without any further ado, yes, let's look at some questions, Phil, and see if we can help the good people on this webinar. So question one. Are health and safety guidelines being modified to put a greater importance on mental health?
That's a good question, actually. And the guidance, are they being modified? Probably not. Is there an increased focus on implementing what has been around for years? Probably yes. I went to a seminar 18 months to, probably nearly 2 years ago now, time flies by in this job, where the health and safety executive made it clear that they have been remiss in managing stress in the workplace. They'd left it to the HR professionals, and whilst the HR professionals are very good at reacting to health and safety, mental health issues, and getting people back to work when there are issues, and making sure that they're looked after, and when the issues arise, the health and safety view on stress in the workplace, which is the key mental health issue that we come across within health and safety, is about preventing it in the first place. So the HSE now have a real focus on preventative measures, so doing risk assessments, looking at how you manage as an individual or as a team or as a business, and how does that put stress on your employees, or how does that put stress on your management. So they've not really changed the guidelines. They've brushed them off, taken them off the shelf, dusted them down, and reformatted them and put them back out there in an easy to use format. But the principles are still the same as they were 10, 12, 15 years ago. It's about how you manage your team. And if you've got any specific questions, then yes, we can help with those. We can help come in and do some kind of risk assessments. We also can provide access to EAP or employee assistance programs, and also occupational health if it goes beyond that, through some partnerships we've got with a few other providers. And not all of these cost you. Some of the partnerships we've got will be free of charge and free to use. So if you have any specific issues, then just feel free to let us know after the presentation.
Excellent, Phil. And I think follow-up question to that is the sentencing guidelines. Do they have anything specific around mental health? I know mental health is now a much bigger topic, as you said, with the health and safety executive itself. But
it's the health and safety executive are not looking to prosecute on stress management and stress at the moment. They've made that clear. They want to be more of a carrot approach rather than a stick approach to improving the problem. But having said that, they've not ruled out prosecuting. So if a business is clearly not managing stress in the workplace, then they will look at bringing a prosecution. The guidelines would be as they are at the moment. There's nothing specific in the sentencing guidelines that relates to a stress or a mental health issue. But obviously, the potential outcomes from stress and mental health can be serious. I mean, I'm not wanting to scaremonger here, but you can be talking suicide. So the potential risks related to stress could be fatalities. So we could be looking at some serious fines should the HSE decide to go down that route. So at the moment, they're taking very much of a carrot approach to encouraging businesses to manage it properly, rather than a stick approach of prosecuting businesses that don't. But who's to say that's not going to change in the next 18 months, 2 years?
I mean, it's fair to say it's an emerging area probably, and it's one we'll keep monitoring closely. Okay, thanks for that, Phil. It's really good. Oh yeah, just yes. If anyone didn't catch it, yes, don't worry about being late or anything. We know people have difficulties getting on the tech. Wherever you are, wherever you're coming from, can be tricky. So don't worry. We'll make sure you get copies of the slides and the video recording afterwards. Okay, another question. Is there a format for risk assessment? That's a nice broad question.
In the legislation, no. There are several formats for doing risk assessments. We tend to advise clients on a scoring matrix type risk assessment, because we have a lot of engineering, construction based clients where the score and the likelihood and probability of an accident helps. But in a lower risk business, even the HSE examples on the HSE website are very, very simple. A risk assessment is, I like to say a risk assessment is not a document. A risk assessment is a thought process. The document and how you record that is just a record of what that thought process was. The very basic format is just a table which records the hazard, or what's going to the hazard, or what has the potential for harm, who's likely to be hurt, what the risk is, what the control measures are, and who's going to implement that control measure. That is a very, very basic risk assessment. So there are various forms out there and various ways of doing that. So we tend to go down and advise clients to use the 5-step form off the HSE website, with a little bit of a bolt-on of the scoring matrix, just to help people determine what's high, medium and low risk. Because if you've got a bit of maths behind it, you're not just relying on a gut instinct. But there's nothing to just turn around and say that you don't have a basic what's going to hurt somebody, what do I need to do to stop that hurting people, and how am I going to do it, which is a risk assessment. So yeah, the answer is there are several formats for risk assessments, and you use which one suits your business best.
Excellent. Okay, keep putting your questions in, guys, and we'll keep answering as many as we can in the time we've got available. Next question. So this one is related to the risk rank, Phil. If my area has a really high prosecution score, what steps should I take? What can I do? What can I do to mitigate the risk?
Well, yeah, I mean, if we go back to the slide a couple of slides ago, then it's about just, if you're worried that you're in a high risk area and you're not confident that you're doing all the things that we had on that slide earlier, so you're not confident that your risk assessments are up to date, or you're a bit worried that you might have missed something, then obviously you can bring in somebody to have a look at that for you, somebody to come in and do a gap analysis, an audit, whatever you want to call that, give you an action plan. And then once you've got that action plan as to what needs to be done at a high level, you can have a conversation with a consultant to see how they can help you, what bits you can do yourself, what bits you might need other people to help you with. Some businesses can put things in place very simply. Other businesses might need a little bit more in-depth work, depending where they are once that gap analysis has been completed. But I would say the starting point, if you're not sure, is to go through a gap analysis or an initial audit and find out where the issues are, and then put together an action plan to address those with your priority ones. Obviously, your big rocks, get those out of the way first.
And I've just got a quick follow up on that one, which is what happens when a prosecution actually takes place? Having worked for a large retailer where things went wrong every day, and having been in court, I can actually give quite a good impact on that one. Some of the prosecutions that you see on the HSE website now are actually for injuries and events that happened in 2015.
So we're talking it can take several years for the HSE to decide to actually prosecute somebody, especially if there's a fatality involved, because when there's a fatality, the police turn up as well, and the police will take precedence on that investigation to start with. So the police will be looking at manslaughter charges. Was corporate manslaughter, is there gross negligence manslaughter against any individuals? The HSE will help with that investigation, and then at some point the police will either decide to prosecute for that manslaughter, or they'll decide to hand that over to the HSE to prosecute under the Health and Safety at Work Act. So you could have an 18-month to 2-year process there before the HSE even become in charge of the investigation. But during that time, you've been interviewed, you're having people coming around asking lots of questions, potentially sleepless nights. There was an article in the trade press about 12 months ago from a company director who, she'd not been charged, there's been an accident at work, the police had come in, unfortunately it resulted in a fatality. The police had come in, she'd spent several nights in police custody, being interviewed under the Police and Criminal Evidence Act, and she talked about how that was a harrowing, stressful, as you can imagine, situation when she was just a company director, and she ended up having to go through all of that. And at the end of it, there was no police prosecution, no HSE prosecution. So you could turn around and say that the actual investigation is probably more harrowing than the actual getting to court bit. But when you do get to court, and obviously it's the same as what you see on TV, you stood in front of a group of magistrates, you're in the witness box, you're swearing on the Bible to tell the truth, the whole truth, nothing but the truth, and you do get cross-examined. And it's having stood in that witness box as a witness, it's not a nice place to be. I would recommend everybody does everything to avoid getting to that situation.
Indeed. Oh, that probably takes us quite nicely onto this this question here. For someone new to the role who has taken over in a health and safety role with no handover, is there that's not ideal. Is there somewhere that one can find a must-have list of health and safety requirements to be legal?
Yes, the HSE website is a good source, but again, obviously the HSE don't provide advice that's relevant to individual businesses, but they do have industry-specific guidance on there. It's sometimes very general, it's sometimes very generic, but it's a starting point. Alternatively, we could have a conversation and identify and point you in the right directions as to which bits of health and safety legislation are priority, important, and not so important to running your business. There are bits of legislation out there like the control of artificial optical radiation regulations, which require risk assessments for exposure to UV from lights in an office, which apply to nearly every business in the country. But I wouldn't actually put anybody as a priority issue on there. So it's sometimes helpful. It's sometimes helpful to have somebody come in and actually say, right, yeah, there's 30 odd bits of legislation that apply to you, but let's worry about these 5 for now, and then come on to the next 5 in a couple of years' time, and prioritise your approach to make sure that you eat an elephant one bite at a time. So making sure that we're taking the right bites out of the elephant.
And if you were approaching health and safety from that way, and you didn't get entangled with the health and safety executive, would they recognise that as a reasonable approach?
As long as you've got a risk register, which is identifying that you're tackling these areas because they're your highest risks.
Yeah.
So if you're in a care home, if you're in the care sector, for instance, if you're tackling falls from downstairs, falls from windows, asbestos, Legionnaire's disease, and the priority areas, and you're probably not quite up to speed on your PPE regulations, as long as you've got an action plan that justifies why you're doing that. Don't take this for gospel, but the worst you're going to get is a letter saying you need to change your priorities. Right. As long as you can show that you're managing health and safety, and you've got a logical approach to doing it, and define timelines to achieve each bit of that action plan, the HSE will actually accept that you're trying your best to manage. And it comes back to what we're talking about with culpability. Something might go wrong, they might decide they're still going to prosecute you, but when it comes to that culpability thing on the sentencing guidelines, you're going to be that low end, so the fines and then everything are going to be lower. Because if you sometimes in a business there is that much to pick up and that much that needs to be done, that you're not going to get everything done in 12, 18, 24, 36 months. You might have to have a 5-8 year plan. Right. You just need to make sure that you're demonstrating that you're working to that plan.
Got you. Okay. Sort of follow-up question perhaps then. Is there a legal requirement on how often a risk assessment needs to be done, needs to be completed?
Yeah, the general one is as and when required. So the regulations basically say a risk assessment should be reviewed as and when it is deemed necessary. For things like DSE assessments, cost assessments, things like that, we tend to say every 2 years unless something changes, which does mean, as the guys in our offices find out, every time they move desks, we're asking them for another DSE assessment because the workstation's changed, which makes me really, really popular within the office. But for a general risk assessment, you would review them every 12 months as a general rule of thumb. But again, unless something indicated you might need to change that. So that would be a change in legislation, whether you've had an accident that's linked to that process. So if you've got a risk assessment for, let's say, if you're a warehouse and you've got a risk assessment for your backyard, and there's a near miss or an accident where a vehicle hits another vehicle or nearly hits a pedestrian, then that would obviously prompt a review of your risk assessments, because your risk assessment should be stopping something going wrong. If something's gone wrong, you need to double check whether your risk assessment wasn't good enough or people aren't following your risk assessment. So as part of your accident investigation, near miss investigation, you would review your risk assessments.
Right, understood. Next question. Someone may have already asked this, but I just want to know if there is an actual need to have a competent advisor. Question.
There is, in the management of health and safety regulations, there is a requirement to have access to competent advice. Off the top of my head, I'm going to say Regulation 7, and somebody's going to Google that now and say I'm wrong. But I'm 90% certain it's Regulation 7 of the Management of Health and Safety at Work regulations. And that says that an employer should have access to competent advice. Now, how you achieve that as an employer is down to your own decision-making process. Larger companies tend to employ that in-house. Smaller companies tend to outsource that to companies like ourselves. But yeah, I mean, it's that there is that legal requirement to have access to that competent advice, because a business owner has enough to concentrate on without necessarily keeping up to date on health and safety legislation. So it's just somebody to feed in the inputs that you need to feed in.
Right, to make those decisions. Okay, that one's clear. Next question. Keep them coming in. We've still got a little bit more time to take on any more questions. Maybe one or two more. So next question. What is the best way to keep up to date with changes in legislation?
I suppose that's a follow-on question from the one that we just had about competent advisors. A good advisor will keep businesses up to date with legislation. Now, I know from our point of view, we've not done that many legislation updates recently, and that's because there's not been any changes in legislation. There's this thing called Brexit, which seems to be getting in everybody's way. But yeah, no, I mean, the way we feed out legislation updates to our clients is through blogs or through webinars like this. So a health and safety consultancy business will feed the legislation updates out to people. We keep up to date by signing up to the HSE news feeds. So when there's health and safety legislation comes out, we get a notification of that. And if we think it's relevant, then we'll pass that on to our client base. Most of the stuff that we're getting at the moment is for the offshore industry and businesses that don't really apply to high-risk chemical sites and clients that we don't service. So we're not really passing much of that on to our clients at the moment. But when anything comes up, then we'll be passing that out and on to people.
Right. Well, as an analyst, I would say you follow. If you go onto our website and you scroll to the bottom, you'll find a little box there where you can put your email address in and sign up to our newsletter. And if we do have, or when we have health and safety updates, along with our HR and our payroll updates, they're included in our monthly newsletter. So as a minimum, you would, if you, for example, taking that newsletter option, you can get your updates every month.
Just as on that, what we are, look, there is potentially on the 29th of March when we do leave Europe, if we leave Europe, depending, there's lots of ifs and buts on there. There will be a change to the chemical legislation if we leave with a no deal. So we're getting the legislation update ready for people, just in case we do leave with a no deal, or on the 29th of March, because the European agency that manages chemicals, if we leave with a no deal, won't be available to the HSE anymore. They have a backup plan, but obviously that will change legislation that refers to that European body. So we're keeping a close eye on that, and once we know what's happening, we'll let everybody know. Probably going to be the 1st of April, the way things are going, but yeah, we'll keep everybody up to date on that.
Yeah, I mean, yeah, I think we'll probably have to do a Brexit legislation special, I guess, for employers around health and safety and HR. So if anyone's got any final questions, please put them in now. With haven't any more drop in, and I haven't got any others that have come through email or anything, so that's good. If you have any more questions, pop them through, and we'll pick them up. But otherwise, I'll just quickly take you through, as we're talking about communications, just a few other ways that you can connect with Moorepay and catch up with these things. So if you email us on info@moorepay.co.uk, that's our general email address, and that'll always go through to the relevant person who can come back and with some help on whatever topic it is. You can always call through on our 0845 number, and again, that'll get you through to the department you require. And any clients on the call, you should already have your contact numbers to get directly through to the health and safety service. And if you don't, please get in touch, and we'll make sure that you've got the latest and correct information. On social media, obviously, we're very active on Facebook, Twitter, LinkedIn, and we always push out our blogs as well on all of those platforms. So if you follow us or connect or befriend us on any of those platforms, then you'll also get updates from Moorepay there as well. And as I say, if you go on the Moorepay website, then you'll find the newsletter sign-up box on the homepage, and I think at the bottom of every blog as well. So that's everything from us on the connection. I'm not seeing any more questions come in, so I think we'll call it there. So thank you to everyone for joining this webinar. I hope you found it really helpful, really useful. If you have any feedback, can you please drop us an email at stuart.clough@moorepay.co.uk. We'll follow up after the session. Once I've got the video all sorted, I'll get an email sent around with link to the video of the recording, so you can share that with anyone else relevant in your business. I will also send a copy of the slides, so you've got those if you need to want to share them or refer back to them. I'll send a link to the risk rank as well, because it's a really useful tool, and as Phil alluded to, there's a lot of effort and energy gone into making all the statistics available to help you just understand a bit more about the risk you can face in your area, just by the very nature of being a business based in that space. And there's a lot of fascinating stuff about it. It's been covered in the Telegraph. It's been covered on the Sun. Lots of online publications as well, Manchester Evening News, places like that. So it's been broadcast widely, which is really keen to make sure as many people as possible learn and know about it and can get some use out of it. So I'll share a link to that as well. Okay, so as I say, thanks to you for joining. I should say thanks to Phil for sharing his knowledge and his wisdom with us today. And as I say, anything else any of the questions that you didn't get around to asking you'd like to, please drop them over, and we'll be happy to pick them up at a later date. Okay, so I'll close it now, and wish you all the very best day going forward. Okay, goodbye.